a lot of patients always ask me, can root canal treatment be completed in one visit? Or some of them had root canal treatment done before and they tell me, hey, my previous dentist did it in one visit. Are you able to do the same thing? Hi, I'm Dr. Elyssa. I'm a root canal specialist here in Singapore, and today we are going to cover the topic on single visit root canal treatment. So let's just look more into this topic and understand a bit more about the thought processes behind it. So before we start, let me introduce to you what's root canal treatment. So for stage 1, it's what we call cleaning and shaping. In layman's term, is known as disinfection. So what we do is we drill a tiny hole, clear out the decay, and we clean out the infected blood vessels and nerves, and also use some chemicals to clean the root canal chamber. So again, this is called cleaning and shaping. Thereafter, for stage 2, we will place some medication, close up the tooth and place a temporary filling, and then for stage 2, we will actually fill it up and do a foundation, and this seals up the tooth. So in other words, first round will be the cleaning, the second round will be the filling up stage. So what is single visit root canal treatment? Like what the name suggests, the entire root canal procedure is completed in one appointment rather than multiple visits. To put it in simple diagrams, this is how it looks like. So for single visit root canal treatment, in visit 1, which is your only visit, we finish stage 1, the cleaning and shaping, and in the same visit, we'll obturate the tooth, which is to fill it up. For multiple visit root canal treatment, the cleaning stage will take 1 or more visits. I'll explain to you why this happens for some cases. And on the very final visit, when everything is settled, then we will do the obturation and the foundation for the tooth. So the advantages of doing it in single visits are this. I've summarized it for you into 4 points. The first is convenience. Patients don't have to travel so often, they settle all in one appointment, and this is good for people who have a hectic schedule. Also, some patients get very anxious before seeing the dentist. Like, I have patients telling me, I get nightmares about seeing you, about the dental drill, and it really makes me so nervous I can't sleep the day before. So if you complete all in one visit, you won't have to think about multiple visits for root canal treatment, and that really reduces the anxiety for most patients. And also, sometimes there's an argument that there's less risk of contamination because in between the appointments, when we place a temporary filling, there could be a chance the temporary filling might come off, and this might allow bacteria to re-enter the tooth. And the last point would be an earlier crown can be done. So if you finish all in one visit, the next visit you can go ahead with the crown appointment, which will be much faster, and this allows the tooth an earlier protection with your general dentist to get it fixed. So the disadvantages of single visit root canal treatment: firstly, case selection. Not all cases are suitable for single visit root canal treatment. I'll cover more of this on subsequent slides. There's also a risk of flare-up. Some patients do say, hey, there's more pain after the treatment, there is a risk that there could be very severe pain or swelling, but really the odds are quite low. It is not impossible, but the odds are low. And at that point in time when everything is sealed in, to do any sort of treatment may be more complicated to undo as compared to just placing a temporary filling. There's also longer chair time, so if you imagine one session having 2 stages combined into one, of course the timing is going to multiply, probably by 1.5 to 2 times the duration as compared to a multiple visit. And at the end of the day, some dentists do get a little tired because canals may not be easy to treat, and your dentist might be tired during the treatment. And yeah, now the question is my tooth suitable for single visit? This was what I mentioned to you, case selection. So firstly, your tooth has to be a tooth that is not heavily infected. So for example, the tooth infection is localized with no significant swelling or pus, or the nerve is alive. The patient presents with less or almost absent pain at the presenting stage. That means the first visit there's no pain at all. There's also a straightforward anatomy. If the root canals are straight, there's no unexpected curvatures, hidden grooves where bacteria could be hiding, this would be a great case for single visit root canal treatment. And also depends on the patient's tolerance. So there are cases where I'll ask my patients, hey, how are you feeling after stage 1? If you're comfortable, let's move on to stage 2 today. However, if they're telling me, hey, actually my jaw is a bit tired from opening, I'm in a rush, I have a lunch appointment, can I do it another day? Sure, we can do it multiple visits. So things like that. So at the end of the day, you have to discuss with your dentist. So single visit root canal treatment is not suitable when we have this following cases. First, you have a very bad infection. So over here, you can see there is a huge abscess with pus coming out. Even here, there's a pimple which collects a lot of pus over there, which is what we call a sinus tract. And in this case, After we drilled in the root canal cavity, there was a lot of pus coming up, and clearly, such cases require more than one visit because we do have to put in inter-appointment medicine to calm down the infection, change the tooth to a healthy state before we can proceed with confidence to know that it's ready for stage 2. There are other instances when it's not suitable. So for example, if you see complex anatomy like this, we can see that it is a very long root, there's some slight curvature, and over here you can see the root canals are fusing together. This is typical of a C-shaped molar, which is a complex anatomy. There's a lot of hidden isthmuses, grooves where bacteria can hide. Personally, this case, I would prefer to put some medication inside so that it can kill the bacteria throughout the couple of days in between the appointments rather than to finish it all at one shot. And for this case, look, there's so much calcifications. So if you look at a normal root canal, there's one line here. This one here, we don't really see much lines because it's all calcified, which means that there's a lot of stones in there. It's not easy to treat. This one, definitely multiple visits. So in this case, each of them took about 2 visits. Reasonable amount of time to get good outcome. And then it's also not suitable for retreatment cases. By and large, a lot of cases that need retreatment have established infections. So if you were to open up the tooth, sometimes you might see a lot of debris like this. It's very dirty looking, sometimes there's pus inside. So usually what I'll do is I'll clear it out and put a round of medication to kill the bacteria before we move on to obturation. So this takes around 2 to 3 visits. So in other words, we have also talked about patient factors. For example, you're tired or there's limited time due to your schedule, then let's do multiple appointments. And also at the end of the day, the big question that I always ask myself is, does this case need intracanal medicament? That means, does it require medicine in between the appointments for the outcome to be better? And if yes, let's not rush it in single visit root canal treatment because we always want to look long term. We want to look for long-term success instead of quick and fast treatment. So looking at the literature, this is a Cochrane systematic review in 2022. This group of dentists published a very good paper where they compared single versus multiple visits for root canal treatment. So with literature to back us up, we know what we should do for patients. So let me go through with you the findings in layman's terms. So in terms of success and healing, they found that at the 1-year mark, there's no difference in radiographic failure between these approaches. That means both of them actually have similar success rate. And there is no evidence that one approach prevents complications better. So in other words, doing it 1 visit or 2 visits are similarly effective biologically. Then in terms of pain after treatment, there's a group of patients that mentioned that there could be possible pain in single visits because a lot of things have been done in that one appointment. But at 72 hours, there were no clear differences between both groups. And overall, there's not much difference in terms of use in terms of painkillers. So pain differences are summarized to be maybe small and short-term when you compare between both groups. And then in terms of the problems, there's no difference in terms of flare-up, how severe your pain could be, how bad the swelling or infection could be. And there's also no difference in terms of the presence of tooth loss. That means long-term wise, if you're looking at root canal treatment, we want it to last. A tooth loss, which means an extraction of the tooth, is a failure, and there's clearly no difference. So overall, we can show that there is no clear evidence to show one treatment modality is better than the other. That means you can either do single visit or multiple visits. So in summary, the key take-home message from this is each tooth is different, so the number of visits required for the root canal will really depend on your specific situation. So I would say that each patient, each tooth has its own challenges. So if you like to, you should come down for a consultation to see which one works the best for you in terms of your schedule and in terms of your management for root canal treatment. At the end of the day, we want to think of long-term success and we just don't want to rush through the treatment if it's not possible. But if it's possible, we can definitely work out a plan to do single visit root canal treatment for you. Thank you!